Hi, my name is Nicole, and my proposal is to reduce drug overdoses in New Mexico. In 2003, New Mexico led the U.S. with the highest rate of unintentional and undetermined overdose deaths, with a massive rate of 17.5 deaths per 100,000 people, as compared to the national rate of only 7.5 deaths per 100,000 people. According to the New Mexico Department of Health, from 1990 to 2001, New Mexico's death rates for drug overdose has more than tripled and continued to climb, costing the state an estimated $890 million in 2007 alone. Problems that need to be addressed include individual factors such as multi-drug use, drug injection administration, and a loss of tolerance to contextual and/or social factors such as using in public locations, using alone, and with people who may be less likely to call for help, to diminishing environment and increased drug parity. Prescription opioids, or prescription drugs, caused 34% of unintentional drug overdose deaths in New Mexico during 1990 to 2005, emerging as a leading cause of overdose death. Rio Arriba has the highest drug overdose death rates with 67.7 deaths. Mora comes in second with 61, and third is Catron County with 42.5 deaths. All death rates are per 100,000 population. The proportion of total unintentional overdose death caused by heroin, prescription opioids, and cocaine and alcohol and/or drug combinations together ranged from 89% to 98% during 1990 to 2005. The project plan is to focus attention on prevention methods, implement stronger drug abuse prevention programs into schools, target youth, target counties and areas that are at higher risk for drug overdoses, as well as further evaluate current programs. The program will focus on educating students and youth on the dangers and consequences of drug use. It will also provide strategies and advice for participants to utilize and apply in their everyday life. The program is designed for students grades 6 through 12. Students will face real-life scenarios and get experience on how to handle situations in which they may feel tempted or peer-pressured to even begin trying drugs. If there are students that have already experienced drug use or have an addiction or even know someone that has an addiction, the program will provide tools and resources to begin intervention and help the individuals. The average effective school-based program costs $220 per student. For every dollar spent on these programs, an average of $18 per student would be saved over their lifetime. Previous programs have saved state and local governments $1.3 billion, including $1.05 billion in educational costs during 2003 and 2004. Reduced social costs of substance abuse-related medical care, other sources, and a lost productivity over a lifetime by an estimated $3.3 billion. To achieve these savings, school-based prevention programming would cost an estimated $220 per pupil nationwide, as I had mentioned earlier. This cost represents the average across the 11 school-based prevention programs analyzed previously by the Centers for Substance Abuse Prevention. The return on investment in school-based prevention services would range between $7.40 and $36 per dollar invested, with a median estimate of $18. The best estimate equates to a net savings of $3,740 per youth served, including a $74 net savings in medical and other resource costs. Since expected medical and other resource cost savings exceed program costs, the program would yield net savings costs to our state and society. School-based substance abuse prevention programming that effectively addresses substance abuse appears to be an excellent investment and is likely to pay for itself in resource cost savings alone. According to the Centers for Substance Abuse Prevention, effective prevention programs would reduce marijuana use by 11.5% and cocaine use by 45.8%. The following chart is high, medium, and low estimates of potential near-term cost savings to state and local governments for implementing nationwide school-based substance abuse prevention programming. According to the federal government, the Department of Education provides $137.1 million nationwide. This funding is to scale up the implementation of evidence-based, multi-tiered decision-making frameworks to improve student academic and behavior outcomes. There is evidence that youth risk factors are reduced in schools where these frameworks are implemented well, and that reduced risk factors are correlated with reduced drug use, among other improved behaviors. We must address this issue because our current attempts have not been enough. It is costing our state millions and millions of dollars. Prevention and awareness is going to be vital because we must target the younger generation to stop this problem in its tracks so that our youth can grow up drug-free, pushing themselves to have a brighter, longer, and more commendable future. It is our responsibility to put in the time, expense, effort, and determination to fix this problem that has already gotten far out of hand. Let's turn this plan into a reality. With your participation, it is possible. Thanks.